Thank you very much for the opportunity to share the work that we are doing with you to address many of the mental health gaps that exist for students in higher education and some of the strategies that we are thinking about to reduce barriers to care. My name is Adam Brown. I am a Vice Provost for Research and an Associate Professor of Psychology at the New School for Social Research in New York City. I'm trained as a clinical psychologist where I direct the Trauma and Global Mental Health Lab that specializes in the development and implementation of scalable mental health interventions, some of which I'll be talking about today. As many of you know, students enrolled in higher education are facing many mental health challenges. This existed before the pandemic, but has only since been exacerbated. In many universities and colleges around the world are struggling to figure out how to address many of our students' needs now and in the anticipated future. Many of you are probably familiar with the statistics that significant numbers of students report anxiety, depression, issues of substance abuse, and for many students this is impacting their academic outcomes and their prospects for education and employment in the future. In addition, many of the specialists on campus are indicating that they are overwhelmed by the number of students who are seeking care in counseling centers and in other places that they might get support for their mental health and well-being. This is true in the US, and this is certainly true for many institutions throughout the world. What might be one way that we think about reducing some of these gaps? There are a number of frameworks that we can consider. One is called the stepped care model. Stepped care assumes that not every student will need the same intensity of care for the kinds of challenges that they're experiencing. Because as we know, the more invasive and the more intense the intervention, often the more costly, and we don't necessarily always have the resources or the need to treat all students with the same kind of intervention. So stepped care assumes that we can create more personalized, more tailored approaches to meeting the students' needs where they are at, and in some ways may be able to provide and prevent a lot of chronic issues emerging from the first place, and whereby taking some of the burden off of our more specialized form of care, such as the care delivered by social workers, psychologists, or psychiatrists. One way to think about stepped care is this idea of task sharing, which has become increasingly recognized as one effective way to build mental health capacity in contexts where there may not be enough resources to address all of the mental health burdens that are present. So what is task sharing? Task sharing is the notion that people who are routinely connecting with individuals at risk for mental health issues, but who may not be specialists themselves, can be trained in basic forms of psychosocial support that they can deliver from within their community. And in many cases, we believe that these individuals are actually best suited to do this because they may share similar identities, similar lived experiences, and really understand the challenges that those experiencing distress are going through. So we believe that it can reduce stigma, increase quality of life, and it is a cost-effective approach to bringing care into spaces where there may not be enough resources, or there may be cultural, social factors that are impacting people's ability to get the care that they need. At the New School, we've started to use a number of task-sharing approaches. One in particular that we've had quite a bit of success with, that we are hoping to partner with other people both throughout the US but also internationally throughout higher education, is a World Health Organization intervention called Problem Management Plus. Problem Management Plus is a 5-session intervention that can be taught to non-specialists who can then deliver that into different communities, that focuses on several techniques, very simple techniques that build coping capacities and resilience. We teach people deep breathing, effective problem solving, behavioral activation to maintain motivation, and how to access social support. And while all of these strategies have been shown empirically to be effective in reducing distress, many of these strategies are quite simple to learn and to be able to deliver in diverse contexts including in higher education. So for example, at the new school, we are training not necessarily counseling center staff in this, but we are training other affiliated personnel who are routinely working with students on issues of their classwork and their learning as a way to connect with them if they are experiencing distress. We've also trained people to be better at detecting distress, so if someone is in need of more specialized care, either before or after Problem Management Plus, they can be referred and stepped up to the counseling center. So just to conclude, we believe that given the needs that we're seeing around the world in terms of mental health care for our young people, this is an important moment for us to pivot and think about the cross-sector, cross-institution partnerships that we need to make in order to truly transform mental health. And I believe that while there are a lot of there's a lot of great research and knowledge coming from mental health experts, our response has to be truly diverse in terms of the numbers of people that we have working on this together, including the training of non-specialists and non-experts to fill some of those gaps on our college and university campuses. This is a very big ask and it is a big challenge, but I truly believe that we are at a moment where we can work collectively and collaboratively to develop these innovative strategies and support our young people now and into the future. Thank you very much. I truly appreciate you attending. My email address is at the bottom and would be very, very excited to hear from you. Have a good day.